The basics of results-based accountability. The objective of this presentation is for you to gain a basic understanding of turn the curve thinking, the concept of accountability for the whole versus accountability for a part, the most important application of this concept, which is the distinction between population accountability and performance accountability, and how to select results, indicators, and performance measures. Results-based accountability is based on the book Trying Hard is Not Good Enough by Mark Friedman, and there is also a companion reader called Turning Curves. Some key principles that underlie results-based accountability. The first is in decision-making, start with ends and work backwards to means. Be data-driven and transparent. Make sure that any accountability framework is first and foremost useful to managers and not just a compliance exercise. And keep it simple, which is arguably one of the most important virtues of results-based accountability, is that it is in fact a profoundly simple framework. Turn the curve thinking. I'm going to use an analogy to illustrate turn the curve thinking and to make the point that it really is common sense. It's what we do every day, but we want to apply common sense to the work we do in the public nonprofit sectors. Okay, so using the analogy of health, where would I begin? Well, I begin with how I'm doing. I begin with, in essence, the end, my weight. All right, I want to begin with my weight and with data, which is I'm going to get on the scale and see just how much I weigh. Okay, and I want to compare that to the ideal weight, right, for myself. Unfortunately, historically, over the last few years, I've been gaining weight, and if I do nothing different, it's not going to get better, it's going to get worse. What do? I ask myself, what's going on here? I got to sort of do the diagnosis before I come up with a strategy or action plan to get closer to my ideal weight. So what's the story behind my weight? Well, as I've gotten older, my metabolism has slowed down, but I haven't changed my eating habits, which are not great. I'm a bit of a couch potato. On the positive side, I do play basketball once in a while, but not that frequently, but it does help. But for that, it might be worse. But when it comes to eating habits and regularly exercising, my willpower is not great. Okay, what now? Well, I want to brainstorm possibilities. Who could help me? Who might lend me a hand? And also what would work? I might do something more formal in terms of sports, join a league, etc. Get a personal trainer, improve my eating habits. Hey, if I became a vegan, I mean, that would definitely work, right? That would be serious strategy. But given my willpower, I might need a program of some kind to even address issues of eating habits. Might want to partner with somebody like a spouse or a friend, even if it's just to go on regular walks. Those are possibilities. What's the action plan? Always want to get down to action. So deciding what would do, well, I'm going to look at what would make the most difference and is in fact feasible. Decided that a personal trainer and then with my spouse going on a walk every day are the two things I can do that are feasible that I think will make the most difference. Okay, now the point here is, yes, that's the means, right? That's ends to means decision making, but it's not a one and done deal. We come back, keep tracking how we're doing, right? See how we're doing over time. Maybe over the last 6 months, I've actually leveled off. I'm not gaining more weight. That's the good news. Bad news is I'm not at my ideal weight. So I'm going to keep revisiting this same process, looking at the story. Maybe now I got to look at some of my eating habits. Maybe I got to look at something like a program to address those eating habits if I want to get to my ideal weight. Ongoing process. All right, so that's applying the principles of turn the curve thinking in an analogy. Now let's go to turn the curve thinking itself as a formal process. 5 core questions. 5 core questions. Now in the book, Trying Hard is Not Good Enough, Mark Friedman actually offers 2 sets of 7 questions. Those are fine. This is just a distillation of those questions into what for us is a little simpler, a little easier to remember. So either works. But using these 5 core questions, let's walk through them. How are we doing? That's the ends. Data-driven, we're talking about data about how we're doing, just like the weight. We were using the actual weight for talking about health, or in this case, how heavy I was, is M. The story behind the curve, number 2. Who are partners, who might have a role to play. Number 4, what would work to turn the curve. And number 5, what's our action plan? Ends to means, and want to be transparent. So here we go, walking through these steps. How are we doing? Put it on a trend line over time, the data you have for whatever that end is. We'll talk more specifically about data in a few minutes, okay, about measures. But for now, put it on a graph over time. The historic is usually empirical. Forecasted is where you're headed if you do nothing different. Very important concept. Not if we apply whatever strategies we're proposing, but rather what happens if we do nothing different. You might be trending in the wrong direction. You might be trending in a good direction, but want to do even better. The key is you're asking, is that okay? Is the forecast okay? And then the idea is, can we do better than that, right? So, quote unquote, turning the curve is doing better than the forecasted trend line. And that's a return on whatever investment you make in terms of resources, political will, etc., in a strategy. Okay. Number two, what's the story behind the curve, right? So now we've got that trend line. We actually have to do the story, do this step to even do the forecast. All right. It's a matter of restricting and contributing factors. What's influencing that trend line, the slope of that curve? Some people think of this as a force field analysis. You want to get to root causes. You can do that by just asking why over and over. That'll drive you deeper and deeper. Be sure you include positive as well as negative factors. You want to know what's helping. Don't want to throw the baby out with the bathwater, so to speak. So you want to know what's working, and sometimes that's something you can expand on. Current and anticipated. Want to look ahead and see if there's anything coming down the road that may not be true now, but will be true later. Changes in policies, budgets, demographics, economy, anything, right? And then internal and external, not just focusing on what's within your immediate control, but what are external factors, because you never know. First, you want to understand them anyway, no matter what, but also sometimes you find you have more influence than you think over factors that you thought were beyond your control, especially when you work with partners. You want to prioritize those root causes. Why? Because that's going to inform your decisions as to what you want to do as a strategy. You want to address the most important, if to the extent feasible, because that's the greatest chance to make a difference. And then always want to ask, do we need additional research? Do we have a good grasp of what's going on here? Do we need to do more to understand better? Because we want to have enough of an understanding that we can have confidence that our strategy is going to make a difference. We want to solve the right problem, so to speak, or problems, okay? 2 tips. Focus on the story. Don't jump to solutions. Don't shortchange the process. Spend time on the story. Get your analysis right. Get to the root causes. Get to a systems perspective before you run off with an idea that may be half-baked and will only be a superficial and not a sustained strategy for turning that curve, okay? And don't define root causes in terms of solutions. So people will say, the problem is they don't have enough training. Well, if you've got staff who are not abiding by the practices you want vis-a-vis security when you get on the internet, and you say, well, the problem is they don't have training. Well, it may be training, but maybe they're just not incentivized, right? And so maybe the solution isn't training. So just be careful. The problem is the behavior. We're not sure what the solution is. We have to better understand the reason for the behavior. Then we can talk about what the solution is. Okay? All right. Partners, fairly straightforward. Who are partners who have a role to play? The key is you even ask the question and realize you don't have to do everything else. You may be able to leverage partnerships and collaborations. You want to look at non-traditional partners as well as traditional partners. The story behind the curve, those root causes, can often suggest partners. And partners are also important because they bring you diverse perspective. And even in understanding the story behind the curve, having diverse perspectives at the table increases the odds that you're really going to get a full understanding of the dynamics of what's driving that trend line. What works to turn the curve? Again, brainstorming. You want to look at what's research and evidence-based. You always want to ask what are low-cost, no-cost solutions so that you don't stop thinking if you can't have new resources, but instead also ask, what can we do differently with the resources we have? Are we using them as optimally, as efficiently, as effectively as we could? Or are we doing things the same way because that's the way we've always done them? Okay. Also want to challenge yourself to go sort of think outside the box. If we had all the resources, do we know what would work? What are some crazy ideas? Let's throw some of them out there because maybe the first crazy idea isn't feasible, but maybe that's going to lead to some thinking of some ideas that are feasible, that are different, that are innovative. So ways to get outside the box in your thinking. And finally, do want to make sure that you've done research vis-a-vis what's out there, what others have done, possibilities, right? So also survey the environment for best practices and ideas. Okay. All right. Finally, your action plan, right? What are we going to do? We commend 4 criteria to you for this last step. Leverage, does it address the priority root causes? Is it going to have the most influence possible on that curve? That's leverage, influence on that curve. Feasibility is, can we do it? We sometimes call this reach. Is it within our reach? Is it something we can do? Okay, whether it's a matter of resources, again, or political will or other issues. Consistent with our values. And last, and sometimes people put this first, which is specificity. Are we being specific enough so that we know what it is we actually are proposing to do, who, what, where, when, and how, not just some vague sense of action, but a specific action plan so that we can actually implement it if we do adopt it. Okay, those are the criteria. You can simply list your proposed strategies, rate each according to the criteria, and those that show high on all of those criteria are going to be your candidates for your action plan, and you'll want to prioritize the set of strategies that constitute your action plan. Why prioritize? Because typically you don't get the funding for everything, so you want to make sure those that you do fund are your highest priority. Okay, so in summary, asking 5 questions. How are we doing? What's the story? Who are partners? What works? And what's our action plan? When you share your thinking with others, you don't always have to include the 3rd and 4th questions. You can really just say, how are we doing with that graph and a forecast about where we're headed if we do nothing different? The story behind the curve with those factors prioritized. And then what's our action plan to turn the curve with those strategies also prioritized? It's a dynamic process. You might start with what's new information about how you're doing, but even without having that information, if you get new factors that are going to impact you, maybe some new policy that's coming along, or a change in the economy, or new partners who come on the scene, or new ideas about what works, maybe something that somebody else somewhere has done. Any of those can be a catalyst, right, for changing your action plan. So it's not rote. It's not 1, 2, 3, 4, 5. It's anywhere along the way you get some new information that may lead to a change in your plan. You want to be dynamic. All right. And to be clear, once you have your plan, changes are just changes. You don't have to go back to scratch. You just share with your stakeholders and partners and his own staff what are the changes we made on our plan. Right. So you don't go back to scratch. You actually just update the plan that you have. And this is a great format for meetings, right? We're going to review the Turn the Curve plan and make changes as needed. We're going to ask basically as our agenda the 5 questions, right? How are we doing? What's the story? Who are partners? Any new information on partners? New information on what works? Does any of that lead to changes to our strategy? Great. End of meeting. Adjourned. All right. So that's Turn the Curve thinking. Now I want to turn to this idea of accountability for the whole versus accountability for a part. And the most important application of that concept, which is population accountability versus performance accountability. So here we go. The whole versus the parts. A whole could be thought of in the first instance as being the well-being of a population in a geographic area. And being accountable for that is very different than being accountable for my agency or program or service, right? So in this case, accountability for the whole versus accountability for the part is what we call population accountability versus performance accountability. Talk more about that in a second, but do want to make the point that the same principle, that there's a difference between the whole and the part and how one would think about each of those kinds of accountability, that same principle can apply even within an agency, where you say the whole is the whole agency and the part is maybe my division or my unit, my branch, et cetera, my program, okay? So we're going to apply this principle, but the most important application of it is this idea of population versus performance accountability. Population accountability is the well-being of whole populations in a geographic area, a condition of well-being. Typically, people are safe, healthy, clean environment, thriving economy, etc. And we make this distinction because we want to be clear. Performance accountability is about how well a particular government, agency, organization, program is working. And we don't want to make the mistake of assigning accountability for the well-being of a whole population to any single program or agency, right? Because that doesn't make sense. It's never going to be the case that a single program or agency or organization can be or should be solely accountable for these conditions of well-being for whole populations in communities, states, nations, etc. So we make that fundamental distinction in large part because we don't do well with population accountability. We historically haven't had a great way to talk about it. This gives us a way to talk about it. But in order to do this work, we're going to need some language discipline. All right. And we say language discipline because in all of this work around performance, accountability, and so on, we find there's a lot of confusion over terminology. People often are using the same term to mean different things and different terms to mean the same thing. So we're going to offer some terminology, some concepts, and suggest strongly that it's very important to be consistent. We don't care what terms you use in particular, but be consistent. So here we go. Result, or population result, which is a condition of well-being for adults, families, and communities. How do you gauge that? We use the term indicator for a measure which helps quantify the achievement of a result, right? That's all about population accountability. Then for programs, governments, services, etc., divisions, agencies, we talk about performance measures as how we measure how well any of those entities are working, right? How they're doing, okay? So that's accountability for the whole versus accountability for a part, right? Indicators for population results, performance measures for governments, agencies, service systems, etc., right? So you can see this coming, I hope, that with turn the curve thinking, it's the indicators and performance measures that we use to provide the data for how we gauge how we're doing. And when we say start with the end, those define the end with data, okay? So put all of this together at the population level, results and indicators. You've got your results and a result and an indicator. And you apply turn the curve thinking to the trend line for that indicator. And that with that, you develop strategies. Strategies consist of a combination of government, systems, organizations, governments. It could be a local government and a state government and a national government all involved in a particular community, or maybe it's a whole country, but it could be a neighborhood even. So governments, service systems, organizations, programs, etc. Each has its own performance measures, and for those performance measures, each applies turn the curve thinking for strategies how to perform in its own role, its own particular piece of the puzzle, its own context. And then cumulatively, all those programs, agencies, etc., cumulatively, they are together what turns the curve on the indicator. So we make that really important distinction. We don't use indicators as performance measures for agencies, governments, etc. Okay? All right. So this then means that we are always thinking about two different conversations, right? In terms of population and performance, when we talk about a population result and its indicators, we're going to ask what are the right things to do to turn the curve on that indicator, right? And that involves joint accountability among stakeholders, right? Multiple partners. When we know what our roles are and what we're going to do, then we ask for each of those different stakeholders, those players, right? For each of them, what is their role and what is their performance measure? What is each performance measure going to be? And how do we use performance measures, right, to determine if we are doing each of those things right? So two different levels, two different conversations. And if I'm in a conversation as a head of an agency or running a program, and it's a conversation at the population level, I don't advocate for my program. I'll make the case if I do think it has a role to play. But the larger question is what's the right things to do? And it may be that the right things to do, what's needed, is not something that my agency does. And I want to be objective enough to see that and to share with others in thinking through what's the right things to do. But when it's about my own agency and a role that we do play, then it's great to be an advocate and to ask what's going to help me to maximize our performance as an agency or a program, right? So all these different programs, agencies, et cetera, together, working each on its own performance measures, and then cumulatively, that's how we turn curves on indicators. Now, that's the most important application of this idea of accountability for a whole, or the whole, versus for different parts, right? And that's population versus performance. The same principles can apply, for example, if we're running a government, a state government, a national government, a local government, right? And we would say, what are the performance measures for that government? And then ask collectively, what are the roles that different agencies in the government play, right? That collectively, what are the right things to do to maximize the performance of our government? And then each, for its own role, has its own performance measures at that level. And cumulatively, each performing and maximizing its performance, cumulatively, those efforts maximize the performance of the whole government. Same thing can apply. That's performance and performance. Same thing can apply for a multi-agency service system, a human services system, or maybe it's a child welfare system, or maybe it's a public safety system, a combination of agencies. might have some measures for the whole system, and then each agency and program in that system has its own measures. What are the right things to do? Are we doing those things right? Same can apply within an agency. So you see how the principle can apply at multiple levels, most important being population versus performance. Finally, we want to talk about selecting results indicators and performance measures. Again, a population result is about a population or subpopulation in the geographic area and a particular condition of well-being. By populations, it can be things like, and subpopulation, like all residents, children prenatal to 5 years old, all seniors, people with developmental disabilities, African-American males, any kind of population or subpopulation within a geographic area. It can be a country, a state, a city, a neighborhood, a school catchment area. So you're defining those parameters. You apply then those parameters to a particular condition of well-being, and you have a result or a population result, which is a statement in plain language. All people in New Zealand are healthy. All residents of Johannesburg are safe. All children in Maryland enter school ready to learn. All people in Belfast are economically secure. All people in Canada have a clean environment. Results. Couple tips. Use a sentence, right? Put it into a sentence, right? We want a particular population, a particular geographic area who are healthy, safe, etc. Okay. Use simple and plain language. Avoid referring to data or improvement, right? It's not we want to improve, it's just we want. It's a condition of well-being, right? And then avoid referencing services. Services are a means to an end. So if you say we want a well-functioning human services system, that's a means, that's not a result. That's a means to a population result, a condition of well-being. Okay? All right. Indicators, examples. For healthy, percent of low birth weights, mortality and morbidity rates. For safe, crime rates. For entering school ready to learn, right? Entering the front end, kindergarten. It'll be an assessment. Percent of children entering kindergarten assessed on a particular tool or assessment tool that they're ready to learn, right? Economically secure, employment rates. Percent of youth who are not in education, employment, or training, which would be indicative that they're not in a good situation. And then environment, air quality rates, percent of days the water is swimmable. These are examples of indicators. Criteria for selecting indicators, less is more, fewer the better. Don't want more than 2 or 3 for any given result, right? Communication power. Does it communicate? Just do people understand it? Keep that simple. Proxy power. Does it measure something of central importance? And we actually sometimes call this importance power. Measure something of central importance, and does the particular indicator lead the herd? So is it something that, if we're only going to select a few, does the direction that indicator goes in typically represent what other measures, other indicators would be doing also? So in education, reading on grade level is an example of an indicator that for a community, all kids are reading on grade level. A lot of other measures would be doing well if that's doing well. Attendance, quality of teachers, etc. Okay. Data power, just do we have quality data available on a timely basis for the particular population or subpopulation in the particular geographic area? Okay. Use those criteria. You list your candidate indicators. You rate them, of course, across those criteria. And if you get high on all 3, that's a candidate for a headline indicator. If you get low on data power, data aren't available, then that's the candidate for a data development agenda. Okay? On to performance measures. Performance measures. Performance measures are the combination of 2 sets of questions, quantity and quality, and effort and effect. We put those together and we say, how much service did we deliver? How well did we deliver it? And how much change did we produce? What quality of change did we produce? We put these together to come up with 3 kinds of performance measures. How much did we do? How well did we do it? Is anyone better off? So how much is who are our customers and how many? What services do we provide for them and how much? Quality is how well did we provide those services? Is anyone better off? What is the desired impact of those services on our customers? We sometimes call those customer results as opposed to population results. Okay, selecting performance measures then, it's going to be numbers in terms of the how much and percentages for the quality measures. So for example, for a drug and alcohol treatment program, a quantity would be number of persons treated. A quality, the how well did we do it, would be percent of staff with training or certification necessary to do the work, right, to provide the treatment. Okay, is anyone better off? Number of clients who are sober either at the end of the program or maybe a year after. Okay. Education, number of students, for how well, maybe a student-teacher ratio. Is anyone better off? Graduation rates, or more precisely, the number of ninth graders who graduate on time and enter college or employment after graduation. That would be a very rigorous, precise, better off measure. Okay, number and percent. Okay. Fire department, number of responses. Response time is how well did we do it. Is anyone better off? Did we keep the fire to the room of origin? Okay. And then for all measures, it's important to note that the how much did we do is the least important. Is anyone better off? Especially percent is the most important, right? Very important to look at quality of service, but really most important is anyone better off. Typically, as people begin to focus on this kind of measure, they're concerned that it's where they have the least control. And the answer is that's when you focus on partnerships. How do we collaborate with others, right, to be effective when we know there are influences beyond the control of our immediate program or agency that influence the folks we're serving? Partner with others. If I'm doing an after-school program, maybe I'm going to partner with an agency to help get kids there, maybe another agency to help get the facilities, etc. Partnerships. Okay. Criteria for selecting headline performance measures. Just like indicators, less is more. Don't want a bunch of measures, 3 to 5 for any given agency, service, etc. Right? Same idea for criteria. Communication power, proxy power, again, sometimes called importance power, and data power. Apply the same principles, do the same drill. Those that show up as high on all three are candidates to be headline performance measures. Those that are low on data power are ones that you want to put on a data development agenda. And there you have it. Okay. And as we said, you plug indicators and performance measures into turn the curve thinking, right? Or you plug in turn the curve thinking into indicators and performance measures. And that's how you have really a comprehensive framework that can go from the well-being of whole populations to the performance of the smallest unit in an organization. So in summary, the key elements of results-based accountability that you've been introduced, at least on a preliminary basis, you've been introduced to are turn the curve thinking, accountability for the whole versus accountability for a part. In particular, the most important application of that concept, population accountability versus performance accountability. And finally, selecting results, indicators, and performance measures. And I should add the importance of language discipline. Thank you.